Sure we have time. Thank you all for being here, and I will turn it over to Lexi.
Yeah, so hi everyone. Like it was stated, my name is Lexi, not Carly. So I'm a prevention specialist with Vivint Health in the Milwaukee area. So we service everyone in the city of Milwaukee and then Milwaukee County, and then we also have various locations throughout Wisconsin that do the same within different cities and counties. But yeah, so this webinar series is going to be kind of on harm reduction 101, just kind of taking the time to explore the core principles and foundational practices that kind of shape the harm reduction work that we do here at Vivint. So at Vivint Health, we do all of our presenting through something called the Harm Reduction Technical Assistance Center. And basically, this is just allowing us to advance harm reduction through practice and education. It's something that people are already doing and engaging in their everyday lives, oftentimes without even realizing it. So, by continuing to build the foundation and prioritizing prevention, it just allows us to create a meaningful and lasting impact in the communities that we're serving. So yeah, like I said, we got awarded a grant to be a harm reduction technical assistance center. So basically, that just means that we can go around and educate individuals and folks on different harm reduction practices. So basically, it strives to be a connection between harm reduction programs and the resources and experts that can help programs better serve their communities. So it's an effort to identify gaps and needs in the current landscape of harm reduction in Wisconsin and to fill those needs through technical assistance. It's available to agencies and organizations within the state, and then they just provide the different trainings. So I did just want to do a little content warning slash disclaimer. So we will kind of be discussing some sensitive topics. So I just wanted to acknowledge that up front. So you can make the decision for yourself kind of at any point if you wanted to just step away, or if something's overwhelming. No judgment. Our goal is to just ensure that everyone feels safe, supported, and comfortable and gets the knowledge, but also does it at their own pace. And if you'd like to discuss any of the topics further, but don't want to do it in like this open of a setting and want more of a like private setting, I can share my contact information and Carly's information will be at the end of this as well. You can feel free to reach out at any time as well. Both of us are people with lived experience, so we can both help answer different ranges of questions. So yeah. It's definitely going to be going over some drug use, sex, syringes, overdose, fatality. So, like I said, just feel free to excuse yourself at any time. So just kind of going over what Vivint Health does. So we're an HIV medical home. So basically what that means is we offer comprehensive wraparound services for individuals who are living with HIV and then people who are in active drug use. So if you're someone who identifies, or if you're someone who's living with HIV, our services will include primary care, for your medical, the HIV treatment and medication support. We offer mental health and behavioral health services. You also get access to a case manager, and then there is always a case manager on duty and on site as well, if your case manager is not available. They offer assistance with housing. We have a food pantry, so it allows food access. And then they can also kind of help with insurance navigation to just really ensure that individuals are supported in their whole health. So, like I said, we have different locations spread across Wisconsin. So, in total, we have 10 kind of spread. So for prevention services, this is going to be for individuals who are currently in active injection drug use. So we offer a LifePoint program that basically provides harm reduction services such as sterile syringe access, safe disposal. So if anyone wanted to get rid of any used syringes, they can bring them into Vivint and then we can dispose of them properly for them. We also do naloxone distribution. which is Narcan, fentanyl test strips. We also just recently started xylazine test strips as well. We do wound care education and overdose prevention. We also offer HIV and hepatitis C testing, as well as a few other common STIs at various locations. In the Milwaukee location, we kind of do the most, I would say. We do HIV, Hep C, syphilis, gonorrhea, chlamydia. And then if you were to come back positive for any of those, you can seek treatment with us as well. So this is kind of just going over those as well. So like I said, the testing, and it kind of goes through the whole process. So say you were to come back positive with anything, we kind of go through the whole counseling with you, the referral process. If you don't want to get care through us, we'll kind of help give your results to someone else, just kind of in that different referral method. We also do condom distribution, so kind of anything to prevent the spread of HIV, Hep C, and STIs. We do different sizes, different types, latex free, all that kind of stuff. And then the syringe access program. So we do various different sizes at different offices, but anywhere kind of gauging from a 27 gauge to a 31 gauge. And kind of all the materials that would come with to allow for safer use. And then just the prevention, education. And then we also do offer PrEP navigation as well. So if anyone was looking to get on PrEP, we offer that as well. We also offer PEP now at different locations. That is if you were exposed to someone living with HIV, then you can take the PEP medication within 48 hours and it'll kind of uh, take that exposure away. So now kind of going into the harm reduction philosophy and kind of the principles and morals that we kind of go off of. So, what is harm reduction? So, it's going to be a spectrum of practical strategies designed to reduce the negative consequences associated with certain behaviors, including drug use, but it doesn't have to be just that. So, it acknowledges that drug use exists in our society and focuses on minimizing risk rather than ignoring it or judging it. And it's not condoning or condemning substance use, rather, it's prioritizing safety, health, and dignity by meeting individuals where they are and supporting their safer choices. We can't change anyone's mind, but we can definitely help them to practice safer use methods. So like I said, it's an approach that really focuses on reducing the negative consequences associated with risky behaviors. It's not necessarily taking the risky behaviors away. And not really requiring immediate change or abstinence, knowing that that doesn't really work for everyone, and it's not a one size fits all method. So how can we reduce the negative consequences that are going to come along with the behaviors that people may be partaking in? So it takes a practical and compassionate stance by minimizing the harm instead of ignoring or condemning the behavior. Like I said, central to this approach is really meeting people where they're at and respecting their current circumstances and where they feel they are at in their current use. And it's also building trust with them and kind of supporting their gradual steps toward healthier outcomes. Ultimately, it's just going to be prioritizing dignity and safety, and then improving that person's quality of life. So these are just going to be some examples of harm reduction. And like I had mentioned before, a lot of us practice harm reduction every day, but we just don't know it. And we never really had like a term to kind of say, oh, this is harm reduction. So the first, I think 5 or 6 are kind of going to be things that you just do without even knowing. So wearing a helmet, putting on sunscreen, having a cigarette filter in, wearing a seatbelt and following speed limits, using condoms and lube, and then kind of the more drug use side, so syringe access programs, things like safer consumption sites, so where someone can go and they can use with the nurses present and doctors present and people there ready and able to help if they were to experience an overdose. Carrying naloxone or Narcan, and then just like various policy changes. So it can be kind of anything ranging on the spectrum. It's just kind of what you think you're practicing in the time. So these are going to be just some different goals that we have in harm reduction for our people who are using drugs. So it's kind of going to be to empower folks and reduce the stigma. So it helps to prevent adverse health outcomes by providing the access to sterile equipment, which is going to significantly reduce the risk of different infections like HIV, hepatitis C, um, syphilis, all those kind of things, as well as complications like abscesses, which you may have seen many times if you know anyone who uses through injection drug use. But it also plays a critical role in reducing mortality by connecting individuals to life-saving tools and support, including overdose prevention, resources, different healthcare navigation, and referrals to essential social services. Additionally, it can support treatment for drug dependence on the client's terms, so offering options such as medication-assisted treatment or MAT. So down in Milwaukee, we have community medical services. I believe they're all over the state as well. But we have a lot of different clients who they are in medication-assisted treatment, but they're not quite to the point where they're done using. So they're doing kind of both and practicing harm reduction in that way. So they're slowly but surely trying to get off drug use by being on MAT, but kind of doing both in the time, as well as inpatient and outpatient services. So just various services that you can find for treatment and without requiring participation as a condition of care. So why do we practice harm reduction? Like I said before, it's going to be prevention of those things like HIV, Hep C, STIs, also adverse health related illnesses. So illnesses from used equipment, abscesses. It's going to help with vein care. And it just allows us to kind of give that motto of we care about all people and not just certain people when we think they're doing the right thing. And then this is kind of just going to be a graphic that shows what happens to a needle with repeated use. So over time, the tip is going to begin to bend and dull. It's going to make it less sharp and less effective, which can increase the risk of injury and harm with use. So the new needle is the one on the left, and then kind of going to the right, it's the needle used once, needle used twice, and then a needle used 6 times. So essentially, we would really love after every new needle you use uh, once and then you do a new needle. So these are kind of harm reduction musts that we like to follow. So kind of just always being participant centered. So meaning the needs, goals, and voices of the individual guide the approach and how you kind of are centering the care. So it's important to actively include the client input and create a welcoming, non-judgmental environment where people can feel safe and respected. So also means recognizing and honoring each person's identity, different things that involves their cultural background, spirituality, their sexual identity, just kind of making that whole person centered. Um, Effective harm reduction addresses immediate needs first, operates with low barriers to access, and remains flexible and adaptable to different situations. Like I said, recovery is not going to be a one size fits all, and harm reduction is also not going to be a one size fits all. So it's really being adaptable to what kind of happens and what's thrown at you. But at its core, it's definitely meeting people with respect and understanding and cultural competence to provide care that truly fits their lives. So these are going to be kind of harm reduction dues. So harm reduction amplifies the voices of participants by valuing their lived experience and creating space for them to actively shape the programs they use. They're kind of the experts in their field, so we're allowing them to and creating the space that they can say their expertise in what they are the experts in. So it fosters collaboration, kind of ensuring that services are relevant and effective and truly meet the community needs, not that you're just referring someone over to something and they kind of get lost in the system. Do you know who you're referring them to? Is it a good hospital? Do you like the treatment that you hear? Do clients come back and they say, yep, I really liked it there. That doctor was super cool. Or nope, I didn't really like that experience, and kind of really hearing them out at that. And so at the same time, it also is going to connect individuals to resources that support their overall well-being. So, like I said, from healthcare to different social services, but also ensuring that those touches are meaningful and that you're not just sending someone to send someone to a referral. But by providing tools, education, and support, harm reduction works to reduce the harms associated with drug use, like I said, including lowering the risk of HIV and hepatitis C transmission. So what harm reduction does not, and these are just going to be kind of some things that you hear kind of when it comes with SSP, so syringe service programs, and just different harm reduction facilities. So it does not increase syringe litter in communities or contribute to higher rates of drug-related crime. In fact, actually, many programs help safely dispose of the equipment and improve community safety. It's actually really hard to find somewhere to dispose of needles that have been used. So we even have like people who bring in their diabetes needles and dispose of them in here. So if you really think about it, it's improving the community safety by allowing uh, a place for people to bring the syringes. We have to, on the other end, on the back end, pay for them to be disposed of. And so a lot of people don't know that. So it's not the easiest thing to do in a safe manner. But it also does not replace or dismiss treatment or abstinence. Instead, it recognizes that abstinence or reduced use is one form of harm reduction among many. So if that's the route you want to go, you definitely can, but that's not the route that we're going to push on you. And most importantly, harm reduction does not encourage or condone drug use. It simply just acknowledges that drug use exists and it focuses on reducing the negative impacts. We know you're going to make the choices that you're going to make, but how can we kind of make them healthier choices? So these are just some outcomes that we have found and that have kind of been found worldwide. So harm reduction programs have strong evidence supporting their effectiveness, particularly syringe access programs. Which are among the most successful models for preventing HIV and hepatitis C transmission. Outcomes are even stronger when participants have a voice in how programs are designed and delivered, as this increases trust, engagement, and adherence to prevention strategies. When you hear something that, hey, I would like this to work better in this way, or your hours aren't really working this way because we work 9 to 5, kind of taking what they say and building your prevention strategies off of that. And additionally, programs are most effective when they are built on strong partnerships and provide seamless connections to healthcare and social services, ensuring that individuals can easily access the full range of support that they need. And then this is just a CDC study that came out in 2019 that just found that users of syringe service programs were 3 times more likely to stop injecting drugs. Something that we hear very often is you're always talking to someone and you're always coming in and kind of addressing the drug use. So if someone was to come in to get new needles and they wanted to talk about recovery, you're always having that touch and you're always having that trust aspect with them. And then another quote from it was that when two similar cities were compared, the one with the syringe service program had 86% less syringes found in places like parks or sidewalks. And then this was a focus group that Carly conducted. So they better wanted to understand like community needs. So they conducted a focus group with 50 participants from the Fox Valley region. The participants were divided into small groups to encourage open discussion and meaningful engagement. Through those conversations, they were able to gather feedback on like needs, experiences, and perceived access to resources, and kind of helping to inform the response and effective programming going forward. So some feedback on stigma that they got. Throughout all 7 listening sessions. The topic of stigma was the main point. So they just wanted to they wanted everyone to know that just because they use drugs, that doesn't make them a bad person. So there were just some quotes that people had. So I'm not going to hurt you just because I'm high. I felt like I got a little more done. I ended up getting a vehicle. I was getting back to having a routine in life instead of just living in pain. And then these were this was a quote on healthcare stigma. So this was someone they said, I had sepsis and I admittedly was so sick. Like I'm on my deathbed. I'm on fentanyl and methadone, right? So I was withdrawing so bad and they started poking, looking for a vein. And I'm like, dude, I don't have any veins. You need to get the ultrasound machine. They wouldn't buy that. We have to try. We have to try. They literally sat and tortured me for 20 minutes. So someone who knew their body and was trying to express that to healthcare professionals, but kind of wasn't getting through to them just because of the overall stigma of drug use within the healthcare system. And so then kind of reframing our thoughts. So just some more quotes. I pretty much wanted to die most of my life, but then once I started using, I started trying to live. For 8 months, the participants said that they would use once per day after 5 p.m. and never 3 days in a row. I wanted to take the edge off after I went outside and did things all day. They expressed that being disciplined in their use worked for them. I felt like I got a lot more done. I ended up getting a vehicle. I was getting back to having a routine in life instead of just living in pain. So, kind of just showing that too, drug use isn't just all people just looking for a good time and looking to get high. It is sometimes a way that people do get by, and kind of reframing that some people do active drug use daily and can still be functional and can still have that everyday function within their life. So now I'm going to kind of just go over the syringe access program supplies. So kind of just going over the harm reduction equipment that we give out. So it's designed to support disease prevention by reducing risks associated with drug use. Each type of equipment serves a specific purpose in helping prevent the transmission of infections and other health complications. Um, Rather than labeling anything as completely safe, harm reduction emphasizes safer practices and a hierarchy of safer use. So instead of saying this is a safe way to use, it's a safer way to use. And kind of just that model of if you don't have this, try this. So first, and obviously the main thing that we give out are syringes. So they can often be referred to as needles, rigs, darts, or points. And they're used to mainline or inject drugs directly into the bloodstream. Different substances and injection practices may require different sizes and types of syringes to reduce the harm and improve the safety. Kind of just like an example, we do 27 gauge and 29 gauges. 27 gauge is going to be a thicker needle, and a lot of times people that are more seasoned users will do the 27 gauge just because it's harder to get their veins, harder to poke through the skin, so they just kind of need the thicker point. But from a harm reduction perspective, understanding syringe use is important for preventing disease transmission. HIV can survive in a used syringe for up to 42 days under the right conditions, while hepatitis C can remain viable in a syringe components for 60 days or more. So, say you were sharing needles and someone had one and they were living with HIV, that can be in the syringe for up to 42 days as well as hep C. So this kind of just highlights the importance of sterile equipment and using a new needle every time. These are going to be caps or cookers, also referred to as caps, tins, or spoons. They're commonly used to mix, heat, or prepare the drugs prior to the use. So from a harm reduction standpoint, these items are important to consider because they can always carry risk for disease transmission if they are shared or reused. So same for this, hepatitis C can survive in cookers for 14 days or more, again, under the right conditions, just highlighting the importance of using a new one every time. And then these are going to be filters. Filters are also often called cottons. That's what we refer to them as in our clinic. But they're just used to filter out particulates when drawing substances into a syringe. So while they serve a practical purpose, they can also carry risk if they are reused or sourced unsafely. So cigarette butts are particularly dangerous to use as filters just due to contamination. There's alternatives such as Q-tips. They may be considered somewhat safer. It kind of just all depends and how you're using them. In some situations, pocket lint can also be used, though it also still carries a risk. And then hepatitis C can survive in cotton for up to 5 days. Um, and then unsafe cotton can lead to cotton fever, which is just a painful inflammatory reaction that can occur after the injection. And it is not fun, I have heard.
Lexi, we have a question.
Yes.
We have a question.
Okay.
When you say under the right conditions, can you explain what those conditions are?
Yeah. So I would say like where it would survive, you mean? Like
Yes.
under
Uh,
those.
yes.
Yeah. So kind of just saying, so if it was sitting there, uh, just it hasn't been rinsed, it hasn't been like no bleach has been used on it, if that kind of makes sense and elaborated on it. Like it hasn't been cleaned, it hasn't been sterilized in any way. You haven't tried to clean it or anything. Like you've kind of just someone used the cooker and now it's just sitting there and now I'm gonna go use it again, that kind of thing, if that makes sense.
We have another question.
Okay.
Or maybe, yeah, I guess this will qualify as a question. Someone
Yeah.
referenced to me that people use the dish scratchers for substance use. Would this be considered a filter?
Dish scratchers. Oh, yes, yes. So we use like the chore boy. Is that
I'm
what
gonna
we're
wait
referring
for
to?
them to
Okay.
maybe answer in the chat.
Yes, I think that's what they're referring to.
Yeah, so we don't tell people to use the chore boy for filters for injection drug use just because it's so thick and it's like very hard to ball into very small balls, if that makes sense. We do them for smoking filters, so we do smoking kits instead. Like we do everything but the pipe, and we do that as a filter for a smoking kit rather than for our injection kits, if that helps. And because you want something that's more like you want it to be like a cottony sub or cottony fabric type thing. You don't want it to be like that hard kind of material that Chore Boy is.
I think that answered it because there's no more follow-up for that question. And someone just Googled
Okay.
it, and yes, a chore boy.
Yes. Yeah. Okay. So then these are going to be tourniquets. So they can also often be referred to as straps. So it's just meant to stabilize veins during injection, and make it so that they don't roll. If you've ever seen when your doctor takes your blood, they use a tourniquet. So it's just kind of going to be making it easier for someone to locate a suitable vein and improve the overall access to the vein. So by holding the vein in place, the tourniquets can help prevent the rolling, like I said, which is when a vein moves during injection, and then that can lead to missed shots. If you are to miss a shot, that can lead to different things like tissue damage or abscess. And you kind of want to leave that area if you did have a missed shot. So you don't want to go again into that area. You kind of want to just give it some time to heal and recover. So water source, this is going to be kind of a hard one just because we're dealing with a lot of different individuals. Some are unhoused, some are not, some have access to sterile water, some don't. So we try our best to give out these little sterile water packets. If you can see, they're kind of just like little individual sterile waters, and then they can use that as a source. But when we don't have those, the biggest thing that we kind of try to do is a hierarchy of water. So it's commonly used to cook cook, mix, rinse, split, and clean the equipment, just kind of making everything more safe and sterile. So sterile water or clean running water is going to be strongly preferred, while other sources such as puddles or standing water are highly dangerous just due to the different contamination risks that can come along with them. Shared water sources can also transmit infection, with hepatitis C able to survive for 14 days, or more. So because of this, assessing a participant's water source is a key part to the harm reduction. So like I said, we really make it known that we have the water sources if people need. I don't believe all of our offices have them just due to like different funding. But Milwaukee is a huge hotspot for unhoused communities. So we make it a big priority to have the little sterile waters just so that we can give that out as well. And then another really important thing is going to be naloxone or Narcan. Naloxone is the actual name of it. Narcan is going to be like a brand name that someone gave. So DHS is strongly saying that we should just start referring to it as naloxone, just that way. When they start referring to it as naloxone, everyone else kind of knows what they're talking about. So it's an opioid overdose reversal medication that can be administered intramuscularly, intranasally, or intravenously. We do the intranasal and the intramuscular. It works quickly, typically within 30 to 90 minutes to reverse the effects of opioids, and then restore someone's breathing. It's safe to use in people who are pregnant, children, and then pets can also be Narcaned as well. We had someone one time bring in their dog that needed to be Narcaned, so it does work on pets as well, and it's safe for pets as well. And no significant side effects or potential for misuse. The big thing is it will not have effect on someone who has not taken opioids. So it's really important that you're always just getting that medical attention for someone because if they're experiencing an overdose from something else, or it's stimulant related, or it's a health problem like a heart attack or something like that, it's kind of important. Well, it's super important that you get medical help for them. And then, like I said, we started doing drug checking test strips. They were originally illegal at one point, but in certain places, I believe they may still be, but Wisconsin is allowed to distribute them. So basically, they're just test strips that allow you to look for the presence of fentanyl and xylazine within your substances that you're taking. So there has also been an increase in the presence of xylazine, so that's why we started doing those. Xylazine is an animal tranquilizer that is increasingly being found in just like the unregulated drug supply. These substances can be mixed into a wide range of drugs, not just heroin. It can be present in both stimulants and depressants, so that's important to know. And as we know, it's often without the user's knowledge. The test strips just kind of allow you to provide yourself that information and allow you to make the decision going forward. So, knowing what's in your substance, knowing it has the presence of fentanyl, do you want to continue the use? Are you going to change your use? Kind of just different things like that, allowing people to take the decision into their own hands rather than not knowing. And then this is kind of just some other stuff that we try to give out. It's different across all sites just because, again, funding. And some sites are bigger, some sites are more smoking related sites, some are more heavy on the injection drug use. It kind of just really all depends. So the alcohol wipes, those are just going to be used to cleanse the injection sites and reduce the risk of skin and bloodstream infections. Straws are provided to help prevent hepatitis C transmission, so when substances are snorted. And then pipe covers, they support safer sharing practices just by reducing the spread of infection when smoking like crack or meth. You can also use pipe covers when you're doing like weed pipes, so it kind of can be used across the way. Copper sponges, so that's what we were talking about, the chore boy, that can be used in pipes to prevent the substances from being pulled into the mouth. So that's going to be the filter for that. And then we do lip balm as well from to help with any lip burns. And then sharps containers, we always try to ensure that if someone wants a sharp container, we have them on site to allow them to take home with them. They can bring them back then and transport them into our disposal. Uh, all of our sharps containers locks once they're done using. So you just lock it once you're done using, and then you can just bring it back to the office. Something I just like to note that I was told by an officer. I have heard this across. Once it's locked, a police officer is not allowed to open a sharps box because it's considered contaminant material. So I just like to tell people that if they're ever nervous about traveling with them, is that if the sharps container is locked and you make sure it's locked, they aren't supposed to be able to open them. And then just other supportive items, so including triple antibiotic ointment, so just little like minor wound care. And then we also do basic hygiene supplies, so like toothbrush, toothpaste, comb, body soap, things like that. And then just educational materials on harm reduction to promote safer practices. And we really try to keep our literature up to date. So kind of what are the new trends? Abscess care at home, getting the right hit, kind of just all those different literatures that if you don't necessarily want to ask a prevention specialist when you're in the office, you can kind of take that brochure home and it was written by us for users. And so then this is kind of just going over, so what if syringe access was non-existent? So this is a news article, and I'll kind of go over it in the next slide, but they had a huge HIV outbreak. So within a 6-month period, nearly 200 people were infected with HIV, largely linked to the use of the prescription opioid Opana, which was at the center of a significant addiction outbreak. And this was in Indiana. So it's a short-acting formulation led to more frequent injections, increasing the risk of transmission through shared equipment and overlapping injection networks. So the outbreak was further compounded by factors just such as sexual transmission, injection drug use, lots of different like substance use patterns, and then just like barriers to accessing healthcare all around. So together, these conditions just kind of highlight how structural gaps in prevention and care can accelerate the spread of an infectious disease, and then that infection can kind of just take over from there. And then this is just some data on our encounters within the Wisconsin area, within our SSP. So in Wisconsin total, we've distributed over 6 million syringes. I've had about 30,000 encounters, about 56,000 naloxone doses distributed, and then fentanyl test strips, about 45,000. And then naloxone pure saves reported, we have about 2,000. That number is really low just because um, they have to disclose and it's kind of a very personal conversation. So uh, it's just lower just because it's a self-reported thing. They kind of have to take the time to let us know. And then this is just going to be a bar graph of kind of different things that we've seen of the drug testing over our locations in the offices. So it's just going to show the percentage of fentanyl positive drug samples by substance types. So heroin is going to be red, methamphetamine is going to be that teal bluish color, cocaine is going to be black, and then combination or like other is going to be the gray. So it kind of just is overall highlighting that fentanyl contamination is not just limited to heroin, it is present across all drug types and can vary significantly by region. And then, like I said before, this is going to be Carly's information. I can also put my information in the chat as well. But I just wanted to go over if you were ever looking for services in our offices or whatever. We have 10 different locations across. I can put those in the chat as well. If you were looking to contact someone at those sites, you could just look up vivanthealth.org, and then it will kind of show you all the different sites across Wisconsin. We also are in Missouri, Colorado, and Texas, I believe, and then we just went into Illinois as well. So I can put the vivanthealth.org website link as well if you wanted to look up any of the numbers. And then once you call, it'll kind of direct you to different things, and then you can hit the prevention specialist uh, extension, and it'll take you to talk to anyone within our prevention suite. But yeah, that is everything that I have for you today.
Thank you so much, Lexi. This was an amazing amount of information in such a short amount of time. We wanted to make sure that we had time for questions. We know the connection and the link between trauma and substance use. So we wanted to provide information for you all to kind of understand what survivors might be going through and might be using when it comes to a coping mechanism due to the trauma that they experienced. Um, we will be doing hopefully more webinars in the future around harm reduction. So this was like just a great place to start to get the foundational information for everyone. So if you do have questions around future topics, please don't hesitate to let me know. And we can get that started. So if there are any questions, please feel free to pop them in the chat. You're more than welcome to unmute.